for today we would be discussing about specimen collection, reagent preparation, and PCR loading. First would be specimen collection. Process of specimen collection. In the SARS-CoV-2, we consider the quality of the specimen, factors that may affect the specimen storage and processing. Before we proceed to the sample collection used for SARS-CoV-2, we must consider the common inhibitors found in the molecular diagnostic laboratory, which are heparin, disodium EDTA, acidic polysaccharides, and nucleases. These are present in the molecular laboratory, which may degrade nucleic acid, may inhibit reverse transcriptase DNA polymerase, and may inhibit enzymes. So the samples used for SARS-CoV-2 is the most sensitive sample collected to be given to the given analyte, even in an ample amount, is detected through your bronchoalveolar lavage, which is also known as bronchoalveolar washing. It is a diagnostic method of the lower respiratory system in which the bronchoscope is passed through the mouth or nose into an appropriate airway in the lungs. The measured amount of the fluid introduced and collected for examination. This is sensitive because it is directly collected to your lungs. As observed in COVID-19 testing facilities, the specimen collected or method used is nasopharyngeal swab or oropharyngeal swab. So for nasopharyngeal swab, before I proceed to nasopharyngeal swab, other specimens that are considered are sputum, feces, and saliva. So let's proceed to nasopharyngeal swab. Nasopharyngeal swabs are specifically manufactured to have long flexible shaft, plastic, or even metal tips, made of polyester rayon or flat nylon. In addition to nasopharyngeal swab, personal protective equipment is used, including a gown, sterile gloves, protective mask, and face shield. Make sure that all sample tubes have been labeled and that the appropriate requisition form have been filled out before starting the procedure. So in starting the procedure, insert the swab into the nostril parallel to the palate. If you detected resistance to the passage of the swab, back off and try reinserting it at a different angle closer to the floor of the nasal canal. As for the other method is your oropharyngeal swab. It is directed toward the rear wall of the oropharynx, and it is rotated a few times before. After taking the sample, it is necessary to insert both swab from the nasopharyngeal and the oropharyngeal to the same tube, breaking the rod with one swift and controlled movement. Finally, carefully screw the cap. It appears to be extremely important to properly collect nasopharyngeal and oropharyngeal swab in order to minimize the false negative rate among COVID-19 patients. A reminder, when collecting through oropharynx, touching the uvula, tongue, or other part of the mouth should be avoided because RNA viruses are very unstable in which may be easily killed. A reminder also, in collection, calcium alginate swab is avoided and wooden tips because this would be painful for the patient and it is not flexible enough to reach the nasopharynx. As for the preferred swab, it is use of the synthetic fiber swab with plastic or wire shaft. For the media, viral transport media is used or utilized, or if not available, Amy's transport medium or sterile saline is used. As seen on the picture, this is the viral transport media in which it contains salmon pink fluid, and if the color of the fluid is yellow, reject it because it could be contaminated already. Other viral transport media has colorless fluid, but it should not be utilized because it may cause false negative result, and if the colorless fluid transport media is used, the test should be conducted immediately. Unlike the VTM with pink fluid, it could be tested for days, only if it is stored in a ref temperature. Viral transport medium comes with 2 antibiotic combination for reducing the chances of contamination, in which it contains fetal bovine serum and as a cryoprotectant which help the sample to prolong storage. Next is the reagent preparation. Before entering the area of reagent preparation, personal protective equipment should be worn. First is to sanitize your hands either through hand wash or alcohol. Next is to don your laboratory gown, open gown fully, put head on opening and end of the sleeves. Next is to don the surgical mask, ensure that it fully covers your mouth and pulled under your chin. Next is to don your disposable hair cap, then your goggles in order to protect your eyes, and last is to don your gloves. Make sure that it is in an appropriate size to prevent them from snapping. Once the PPE is worn, we may now proceed to the reagent preparation room. The reagents are stored in a refrigerator temperature, but the enzymes are not refrigerated because enzymes are not to be frozen, and if found frozen, reject it. After getting the reagents, it is loaded into the vortex mixer to resuspend the small vials of reagent. Remember not to vortex too much because reagents might get. Next is to load the reagents to the centrifuge and ensure that it is balanced and centrifuge for about 10 seconds. After centrifuge, we may now proceed to the using of reagents. For the reagent mix, using 1000 UL adjustable pipette, insert a filtered pipette tip, open the cryotube in RNAs free and let the reagent pipette up until the dust drop and dispense it in the cryotube. After completing the required amount, dispose the pipette tip, proceed to enzyme mix. Enzyme mix using a smaller amount of pipette the enzyme and take note that the enzyme is very viscous. Then dispense again on the cryotube and dispose the filtered pipette tip because the viscosity of the enzyme may cause bubbles. After dispensing, put on the screw cap of the cryotube and label it with M, which means master mix. After every set of reagent, change your gloves, and after working the hood, always disinfect with UV lights. After the preparation of reagent, we may now proceed to the running of samples. These are the PRC strips in which it is composed of your reagent mixed with your sample. Fluorescent markers are used in PCR instead of dye markers in which gel medium is not used. The PCR machine will detect fluorescent detectors in which depend on gene which is being detected in different channels. This is the software setup that is connected to the PCR machine in which it is automated and each are color-coded for the designated sample that will be loaded. Here are the stages of PCR in which it is composed of denaturation, primer annealing, and duplication. Before loading the PCR strip, ensure that there are no bubbles and remove that simply flaking it. To ensure that the sample reagent has settled down, microcentrifuge is used. Next is to load it to the PCR machine by following the designated number of positions and secure the caps are tightly closed using the lid-free tissue. After doing all, we may now proceed to the software and click Run.